Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you so much for watching our channel. Today we're going to talk about something new, and that is Restylane Kysse. Kysse. As the name would imply, it's the newest FDA approved filler specifically for the lips. And this is made by Galderma, the folks that make Restylane. And they also make Restylane Lift, Restylane Silk, Restylane Refine, Restylane Define. And you know, all of the filler companies are coming out now with what I call like customized fillers specifically for applications like the cheeks or the lips or fine lines and wrinkles. Now, one of the things that I thought was interesting, and I do have a little cheat sheet here because I don't want to leave out anything. So it's a new filler. The company states that it should last for a year, that it has less bruising, and that you need 20% less of this filler than other types of filler to achieve the same result. It has 20 milligrams per milliliter of hyaluronic acid, so it's a robust filler. And one of the things that I thought was the most interesting here is they actually did partner studies, and I think you're going to be hearing a lot about this, where they injected patients and then they had their partner evaluate their lips in kissing them before and after, and that's pretty neat, I thought. So I think this is I'm the first person to get this in Virginia, I believe, and we're going to inject it here in a minute. I'll show you. You can use this with a needle or cannula, however you want. This is for submucosal injection, but again, talented injectors and experienced injectors can kind of put any filler where they want it and where they need it. It's got a great safety profile, and another thing that supposedly that one of the attributes of this filler is it helps smooth the crinkly wrinkles that we get on our lips. Okay, so Restylane Kysse for the lips, and we'll show you how we inject it. Thank you so much for watching. I'm Dr. Joe Niamtu, LoveThatFace.com. All right, we're going to be injecting Restylane Kysse, and we are going to use a needle. Obviously, you could use a needle or a cannula, and we're going to start on this side. This is for submucosal injection, but I'm actually in the deeper area of the lip because we want some plumping here. Injects with a little bit more syringe pressure than the other Galderma products. Restylane has kind of a lighter syringe pressure. They state that you need 20% less of this for the same volume as you would get with another filler. And it has 20 milligrams of hyaluronic acid per ml. It's supposed to have a duration of a year and not cause a lot of bruising. So that is our initial injection. Now we're going to put a little Vaseline on here, and we're going to massage this so it's smooth. We have already treated this patient with topical anesthetic, tetracaine and lidocaine in a plasticized base. Okay, and now we'll move to the lower lip. All right, now we'll proceed to the lower lip. This patient wanted a little bit more of the 1 ml in the upper lip. Open for me a little bit. And we're going to start in the midline, and we're going to go to the wet-dry line. And our target here is the middle of the lip. And every injector does this a little bit different. And I really like to walk around to the other side of the chair when I'm injecting, because when you're trying to look over do everything from one side, I don't think you really get an accurate view of exactly your injection and your symmetry. So I tend to move around a lot. And I like the mechanics of this. It's pretty similar to the other Restylane type fillers. Put your lips together. And it's getting more and more complex. We have Restylane, you have Lift, Refine, Define, Silk. Now I'll take the very last bit and inject just a little bit at the central border. And I like to do that because that really is going to put a little Vaseline on, especially for females who wear lip gloss. That really just pops that part of the lip. So there we are. That's might be the first injection in the state of Virginia of Restylane Kysse. I like it, and we'll see how the patient likes it. I'm Dr. Joe Niamtu. Love that. So here's the patient we just injected. Now this patient is the first time she had her lips injected, I believe, and she's very conservative, so we split one syringe, as you saw. This would have been a great case to use 2 syringes, and I wish that I could have used a little bit more, but she was up for 1 syringe, and that's what we did. But I believe you can see just splitting a half syringe between each lip, what a difference it made. And these are standardized pictures. If you look at her moles, you can see that these aren't enhanced at all. So this is going to be a great filler. I enjoyed this, and it's great having this tool in our bag of tricks. And it's just like my workshop at home. When I need a special tool, I reach in the drawer and pull out a tool specific for the task that I'm doing, and that's where fillers are going. So I'm Dr. Joe Niamtu, lovethatface.com. I do cosmetic facial surgery in Richmond, Virginia, everything from facelifts to lips, and our phone number is 804-934-3223. Thank you for your time. Stay safe.